Welcome to our show, Let's Talk Health. You can also subscribe to our YouTube channel on Healthwire Media for further health updates. To talk about gynae cancers, we have with us Dr. Rama Joshi. Welcome, Dr. Rama.
Thank you.
She is Director and Head Department of Gynae Oncology at Fortis Memorial Research Institute, Gurugram. And she brings to us an experience of more than 25 years in this field. So let us take the discussion forward. So Dr. Rama, what is gynae oncology and how this field has evolved over the years?
I think gynec oncology is a specialty which is dedicated to the management of the patients who have been diagnosed of gynecological cancers, those who have recurrent disease, and also the patients where we have the suspicion of gynecological cancers.
So if we talk about gynae cancers, can you name what are those gynae cancers that we are talking about?
The gynecological cancers are the cancers which originate into the reproductive tract. Like when it originates into the cervix, it is known as cervical cancer. When it originates into the body of the uterus, this is known as uterine cancers. When it originates into the ovary, it is ovarian cancer or fallopian tube cancer. And also we have cancer of the vagina and the vulva. The main gynecological cancers are the most common, you can say, is the cervical cancer, which is the most common cancer of the women of this country. And second most common cancer is the ovarian cancer. Also the uterine cancer is also a problem which we are seeing these days, that the incidence is increasing in the ovarian cancer as well as the uterine cancers, and we are facing a challenge that more and more number of patients are coming to us with the uterine cancers and ovarian cancers.
So we all know that awareness about cancers has been increasing,
Yes.
and especially women cancers, and now we also have a field which is preventive gynecology, where also we educate and we take so many sessions and workshops about educating women about their own health and how they can detect cancer at an early stage. So when we talk about cervical cancer, which you just named, is one of the most common in India, which is a developing country. So what can women do to diagnose it early, and is there any prevention that is available?
Yeah, I think it's a very important question. Cervical cancer is the cancer which is a preventable cancer. Means it can be prevented actually by two methods. One is that it can be diagnosed in its precancerous condition or picked up in this precancerous condition by simple screening methods. If suppose every woman goes for the screening test like PEP test, and also based upon the age of the patient, if suppose a patient is chosen as more than 35, then we can incorporate HPV DNA testing also. So we can pick up certain precancerous conditions. These are the intraepithelial lesions of the cervix. And when we diagnose these patients in the precancerous condition, we can treat them and we can prevent the cancer. On the other hand is the primary prevention of this cancer. This is the cancer which is caused by the HPV DNA virus. So once we know that HPV is the virus which is oncogenic virus, these are there are number of HPV viruses, but it is the oncogenic virus which is responsible for causing this cancer, and that too when it is persistent for over the period of number of years. So when we are vaccinating the young girls, those young girls can be prevented of the cervical cancer, and this prevention can be extended by say about 80% or so. So we can primarily prevent this cancer by vaccinating the girls, and we can screen their mothers so that we can prevent the cancer in their mothers too.
So when we talk about treatment of cervical cancer, there is what we call is radical surgery, and which can be done through so many ways. So when is the best time to treat cancer radically, in which stage, and how is the prognosis?
It is very important for us to know that the cancer is curable when it is diagnosed early, and when this particular cancer of the cervix is diagnosed in its early stages, the cure rates actually goes beyond 90%. So this cancer can be cured with single modality, that is the surgery, and the surgery for the cervical cancer is not simple removal of the uterus, but we excise the surrounding normal tissues and also we might have to go for the lymph node dissection depending upon the size of the tumor. If suppose it is stage 1B1 we are talking about, or sometimes it can be diagnosed as early as that of microscopic cancer, means it is a microinvasive cancer, and the treatment varies based on the stage of the disease, but the surgery can be extended in only stage 1B disease.
So, coming to ovarian cancer, we all know that there is no specific screening tool when it comes to ovarian cancer. So, what can women do who have a family history, or what are the risk factors that they need to understand that they might be at risk, or what are those symptoms and signs by which they present and they should go for a routine checkup or an ultrasound or any other tumor marker which you would advise?
Yeah. I think ovarian cancer is the biggest challenge for all of us, not only here but across the globe, as majority of these patients they present to us in advanced stage, where there is spread of the disease within the peritoneal cavity, and the stage of the patients in which majority are diagnosed means more than 75% of these patients are diagnosed in stage 3C disease. And this happens mainly because of the epithelial ovarian cancer. Epithelial ovarian cancer is the most common ovarian cancer, and the spread starts from the surface of the ovary to the peritoneal cavity, and you can understand that the abdomen itself is the Pandora's box. So, actually the disease keeps on accumulating, the fluid also accumulates within the peritoneal cavity, and these patients do not have any specific symptoms. They present to us with the GI symptoms mainly. They go to the gastroenterologist with some vague symptoms that there is some kind of the feeling of the full early after taking the meals, or they can have dyspepsia, or they can have the feeling like bloating of the abdomen or the swelling in the abdomen. So, these are very non-specific symptoms. So, any of the patient whosoever is having dyspepsia which is persistent for, you can say, for few weeks, or some kind of the bloating feeling is there, some kind of heaviness in the abdomen is there, they should come forward for their own examination, and they should exclude that there should not be any kind of the ovarian problem. So, this is the way the epithelial ovarian cancers present. But we do have the other type of the ovarian cancers which are very common in the young age group. Young girls, they come with this excruciating pain. They will present to our gynecologist colleagues with the acute pain abdomen, and you find that on examination there is an ovarian mass. And when this mass is excised, because the surgery has to be done, because it is a twisted ovarian mass most of the time, or there can be hemorrhage within the mass and it is very fast growing. So, these patients do present to us in comparatively early stage, where the disease is most of the time diagnosed when it is limited to that of the ovary.
So, when you spoke that ovarian cancer is most of the times diagnosed in an advanced stage.
Right.
So, other than removal of the pelvic structures, which includes uterus, tubes, ovaries, and the extra the lymph node dissection that you do, what is the recent advancement when you treat ovarian cancer?
Yeah, especially it is a challenge for us to give the best survival to the patients as well as the quality of life when the patients are in the advanced stage of the ovarian cancer. So, the treatment of this ovarian cancer usually has two modalities of the treatment to be included and considered for the management of this condition. Surgery, which requires a radical surgery, we call it a cytoreductive surgery, where we remove wherever we see the disease within the peritoneal cavity. This will have very advanced procedures like that of the not only the removal of the uterus, tubes and the ovaries, we have to go for the peritoneectomy, means the line of the peritoneal cavity requires to be excised, which is usually has the disease. We have to go for extensive omentectomy. Sometimes we do have to go for the peritoneal, you can say the undersurface diaphragm peritoneectomy, and also the diaphragmatic resections and the upper abdominal surgeries, where we might have to remove, even go for the splenectomy and wherever the disease is. So, it is a very radical surgery, you can say that this kind of the surgeries these patients aim at, and we are doing this surgery with the aim of no gross residual disease anywhere else. But there is a recent advancement which we can extend to these patients is by the HIPAC, that is we go for the heated intraperitoneal chemotherapy, where we are giving this heated intraperitoneal chemotherapy to the peritoneal surfaces after the resection, after the tumor has been removed, so that these microscopic foci also can be killed by using this intraperitoneal heated chemotherapy, that is HIPAC. So, this is the recent advancement. There are other recent advancements where there is targeted therapies have also been added in the management in order to give the good survival to these patients. And it has been seen that when these patients are managed by the Gynae oncologists, then the results are the best. And this is what is suggested in the guidelines, that these are the patients where either with the suspicion of ovarian mass or with the diagnosis of ovarian cancer should be seen initially by the Gynae oncologist and should be managed by the Gynae oncologist in order to give the best results in form of the survival as well as quality of life.
So, coming to uterine cancers. So, uterine cancers usually present after menopause, and most
Yes.
of the women come to us with postmenopausal bleeding. So, when you talk about uterine cancer management, the recent advance is maybe treatment through robotic surgery.
Yes.
So, how does robotic surgery much better than the traditional methods of surgical
I think it's a
management?
very good question, Dr. Nupur. These patients who are diagnosed with that of uterine cancer, majority of these patients, I think you also must have experienced that these are generally obese patients. They have got the morbid conditions of either hypertension or the other morbid conditions are there. And here the surgery plays a very important challenge, because to do the surgery and the open surgery where patient faces lot of problems related morbidity, I must say, because of the long incisions, and that can be reduced by using the minimal access technology of either laparoscopy, but now the recently is a robotic surgery. Robotic surgery gives precision in the surgery, minimum blood loss, and the patient stay in the hospital is most of the time our patients have been discharged the very next day of the surgery. By next day evening the patient goes back home, and the very next day morning patient takes the proper breakfast before we come for the round. So, I think we have not seen any of the morbidity related to that of the incision, and the quality of life of these patients is really very good, and it's significantly it has been accepted very well by the patients, and I think we have done one of the maximum numbers across the northern India. And this is what experience I can tell you, that we operated one patient, heaviest patient of 165 kg, who was refused for surgery, I think in many other hospitals, and then we opted for the robotic surgery, and she is doing good for last 4 years.
Oh, that's wonderful. So, thank you so much Dr. Rama for sharing such valuable information regarding gynae cancers, how we can diagnose them early. If they are preventable, we should look for what is best for us at what age, and how robotics has revolutionized the treatment of management of gynae cancers. It is also equally important to visit a gynae oncologist when a cancer diagnosis of gynecology has been made, and this will make the treatment much easier. You will have a good prognosis, the treatment will be very well done, and you will be in safe hands. Thank you.
Thank you so much.